Thank you. Hello everyone, my name is Andra. I'm a research fellow from National University of Singapore. I'm originally from Indonesia, so that's why I'm going to talk about some of my experience on modeling to inform policymaking, but it's a personal experience, so not going to represent anyone other than me here. I would like to thank the organizer for inviting me to come and talk today. And then also acknowledgement to all my collaborators and especially my supervisors, advisors, and also mentors who Hannah is here sponsoring me to come here. Thank you for giving me the opportunity to talk to everyone in this wonderful workshop. And to put Indonesia into context, it's a massive archipelago located in Southeast Asia. If we drag Indonesia into Europe, it's actually spanned from Ireland to Kazakhstan. It's the fourth most populous country in the world, 270 million plus people, 38 provinces, 514 districts, more than 1,300 ethnicities, and more than 700 languages and local dialects. With that in mind, and also accounting for some of the local authority, and then there's a complex decision-making process with layers of stakeholders, and then when we try to talk with different stakeholders, be it like district level provincial level officers, or national level officers, there will be different needs between different stakeholders in terms of like modeling needs or some type of like public health questions that they come up that modeling can may be helpful for them. And in this talk, I will talk about some of the work that we did with our long-time collaborators, which is Jakarta Health Office. Jakarta is the capital, so there will be some context about like there will be the richest city in the country, so there will be more resources, and then that's kind of like context that we are going to talk about. So Indonesia reported their first COVID-19 cases in March, and it's actually during March even there are not many COVID-19 cases we reported because there's no testing capacity available at the time in the country. So at that time, the governor of Jakarta then went to the media actually reporting this number. In March, actually, there's a 40% higher burials than any other month since at least January 2018. So we had the opportunity to analyze this data. So we had weekly burials data from 2015 to 2020, and then we see actually there's a substantial increases in burials even from the start of the year, starting from January. And overall, in the 10-month span from January to October, we see 60% higher burials during the pandemic than the 5 years period before. And then we also had the opportunity to analyze some of the hospitalized cases in Jakarta collected by the Jakarta Health Office. So we found some similar risk factors of mortality compared to other countries, older age and also comorbidities. But we also found that lower in-hospital mortality than high-income countries, mainly due to younger population in Indonesia compared to high-income countries. But we found some concerning finding of higher rate of deaths in under 5 years old, hospitalized with COVID at that time. So this kind of like led to, this study got picked up by some pediatricians at that time, and then led to some improvement in practice of pediatric cases in the context of COVID at the time. And then from those two studies, I was a PhD student at Imperial at the time, so I was interested in modeling, and then due to motivation is due to lack of testing. I was thinking about like what is alternative data there is that we can use to better understand the epidemic, especially in this type of testing where we don't have that many information actually. So uniquely in Jakarta, we had something called funerals with COVID-19 protocol. So this is people who got buried and just conducted to those who died with COVID-19 or those who have symptoms or contacts with COVID-19 cases, but they died before they got tested. So it's kind of like suspected COVID-19 deaths. And the Jakarta Health Office collected this data, and they actually show this in their the data website online. So using these three data streams, we reconstructed using delay distributions to get onset date, and then we try to estimate some effective reproduction numbers using EPI-STIM, and then what we found here is if we look at the RT estimates on the right side, we have also Google mobility data, the black lines, and then the gray shaded areas is when the median of RT estimates is below 1. We found that the RT estimates from the funeral data actually captured more the reduction in RT more consistently with the mobility data, and we found it's a more sustained impact in the interventions compared to the more traditional data streams, which is confirmed cases and confirmed deaths. And then it's looking better on the RT sides, but we also would like to see whether this type of data is also useful to estimate other measures during the pandemic. So we try to estimate the attack rate, which is the proportion of the population already infected by the virus at the time. So using this data, we used one of the COVID model developed at Imperial called Square model. So the Square model usually to estimate or to model it or to calibrate it, they use the confirmed deaths data. But here we try to fit also confirmed deaths data and also funerals data to the COVID-19 model and to see how much difference in the estimated attack rate from these two type of data sets. So what we found here is in Jakarta, estimates of attack rate at the end of the year 2020 in December is actually 3 times higher using funeral data compared to the confirmed deaths data. And luckily, in the subsequent years, we have some studies on population surveys of seroprevalence conducted during this more or less similar time. We found that estimates of seroprevalence from the population survey is much closer to the estimates of attack rate from funerals data compared to the confirmed data alone. So this is kind of like hopefully in the context of lack of data, lack of testing, this is type of alternative metrics that we may be able to look again in the future. So yeah, just want to sideway a little bit about the pandemic preparedness in the country, because actually local expertise in terms of interface between mathematical modeling and public health is still lacking. And then try to use my privilege of being trained in the UK and everything else, and try to create a WhatsApp group basically to connect researchers and policymakers. So we have 90 people in the group right now. Some of them are people working in the Ministry of Health, some of them academics, some of them students. They are keen on doing this type of work on modeling for public health. So we're aiming to start some workshops and research presentation, hopefully some offline symposium next year. So if you are interested in probably presenting your work or giving us some workshop or other type of collaborations, we would like to collaborate from people from Indonesia, talk to me or send me an email. I can easily connect them, hopefully to work with you. And some summary, so what I feel working with policymaker in the past few years is we need to be proactive approach, especially working for collaborations. So for example, like the Jakarta work, the collaborations that we did is actually started when Hannah and I conducted, we made training or workshops, like 3 days workshop of modeling. We invited some policymakers, one of them from Jakarta. And at that time, actually, there was a diphtheria outbreak. So one of them, like they knew modeling actually could be useful for them. So they asked us for help. We started collaboration from there. It was in 2018. And then 2020, COVID happened. I texted him like, what if I can help with anything? And we started collaboration with COVID. So it's actually a proactive approach because they're also really busy people. So bear in mind that they also have other things that they do. So proactive approach is actually something that I feel in the context of Indonesia very useful. It's also like the mindset that I'm learning, not helping. So initially I thought, I knew some modeling, I can help like this people working in the government, but actually I knew nothing about how data are being collected, how hard they are actually working every day. So being more empathic, like having more empathy about people who are actually collecting the data, and also learning about a lot of things in that type of context. Actually, I'm learning a lot from them rather than I'm helping them. So the needs and appetites are there. I try to talk a lot with people from different district health office, provincial health office, national program, the needs and appetite are theirs, but actually different needs across different stakeholders. And then I'm only one person. I can't really answer all of their questions. So building a community or local expertise or more collaborations between people are actually really important here. And then translation to policy, often we are really not sure about it. We do, like before we publish, we had a couple of back and forth discussions with them about the results, and then what they say, the results are really good, we are really happy, we are going to post it in our social media and stuff like that. But whether it's really translated to policy is a bit difficult because there are also another modeling group in one of the universities in Indonesia embedded within the health program. So we may be contributed to something, but we are not too sure. In the context of LMIC settings, probably methods to leverage some already collected data or some alternative data that is not going to cost a lot, because like we are talking about wastewater surveillance or genomic surveillance, it will cost money and then needs funding and everything. It's not going to be, probably not going to be well run in the LMIC setting. So probably methods to leverage this type of alternative data will be useful. And also lastly, to develop a community of modelers, encourage collaborations, knowledge sharings, and also building some local experts of modelers, especially in my country, Indonesia. And lastly, probably people don't talk about this too much in here, but we talk about public health crisis in the future, but there's a public health catastrophe in Gaza, Palestine right now. So if you would like to do this or do something else to ease their burden, so yeah, please do so. Thank you very much.
Thank you. Time for one or two questions. So there's one here.
Great, thanks for this presentation. It's a great example of some of the challenges that arise with real-world data systems. In some of your slides, you show the percent positivity data from test results, and I wonder what your thoughts are on that as an indicator of what's community prevalence or anything else, whether maybe some of the utility or lack of utility in using this data.
I think from the graph, actually, test positivity is a bit difficult to trust at the beginning because we have really small number of testing. But like at the end, will be there's a kind of like more reliable sample size in terms of test positivity. Well, I think we didn't really explore that because we don't know whether like they were being tested like randomly or some people, because testing at that time at some point people can buy tests and then they got tested, and then some people can be tested like probably like more frequently. So it's something that's the nuance on that type of sampling being done actually also probably need to be considered.
Thank you. Time for one more slide.
Yeah, thank you. I was just wondering, what's the best way we can help you to develop, support you to develop your local community?
That's a really good question. So I think like this is something that I've been thinking like since last year, but I didn't really act about it because I tried initially to make it really perfect. So I need to have a good platform, and I probably need to have a good website. I need to have a good forum, but actually creating WhatsApp group actually really get conversations going easily, at least in Indonesia setting. So I just did it. So this is something that because this only, we did it 1 month ago actually. So I haven't really, and me and my co-initiators haven't really thought about much, but I think this is something that if you would like to discuss with us, and then if you have something, materials that you may be able to share with us, and then I think that will be like very, very helpful.
Thank you. Thanks for that question. I think certainly the Juniper partnership in the UK, Matt and Kira and I were very happy to talk further if there's anything we can share. And probably many others here as well. So if we can continue the Slack conversation well beyond today.
Thank you very much.
How this community is useful. Thank you.